So today, I will be talking about emerging disease-modifying therapies for ALS. My name is Nikita Sood, and I am a second-year medical student at Nova Southeastern University. So the reason that I want to talk about this today is because ALS is known as being a very debilitating and progressive condition, and it has a very complex and often unknown etiology. As we can see from the top left corner graphics, the amount of people that are impacted, about 3,000, is quite a lot. It is a rare disease. However, the life expectancy is what makes it stand out. It has a very low life expectancy, which is why it is so crucial for physicians to look at new medications that are out on the market right now. Up until the last few years, physicians were only able to target the symptomology of this disease, which progresses quite quickly. However, within the last 6 years, the FDA have approved of over 3 medications, edaravone, Relyvrio, and Qalsody, that are making a huge impact in the community of ALS. And that is what I will be mainly targeting today. So in terms of methodology, my team and I usually used PubMed and Google Scholar to look at the progression of this particular disease, or progression of the medication trials. So starting off with the preclinical stage, we looked through each phase to see how it progressed over time and what was the phase that led to FDA approval. So the first medication that I will be talking about today is edaravone, which was approved in 2017. The main point to note about edaravone is that it is a neuroprotective agent. So it acts as a free radical scavenger to reduce oxidative stress. And this buildup of oxidative stress with patients of ALS lead to continued degeneration. And for this particular trial, phase 3 is the one that had the most significant impact, leading to FDA approval. So 5-NT is an oxidative marker that physicians or the researchers were using to track how well edaravone was particularly doing. And they were able to see a significant decrease in this particular oxidative marker, especially to a point when they were looking at the cerebrospinal fluid of patients using edaravone. They were able to see minimal and often no detection of this particular marker. To provide some context, the ALS FRSR is a survey that's used by physicians to tell patients the severity or track the severity of ALS and often the mortality. So all patients with ALS see this decline over the course of the years or after it is first diagnosed. However, with the use of edaravone, they were able to see a decline in the decrease of ALS, which was phenomenal. The one thing to note about edaravone, though, is that when it is first diagnosed, or when ALS is first diagnosed, it is best to use edaravone as quickly as possible, especially before the respiratory function starts to decrease. The next drug that I will be talking about today is Relyvrio. And for Relyvrio, we are able to, what's so significant about Relyvrio is that it is a combination of 2 separate drugs. In ALS, we tend to see mutations and aggregations of proteins. And what this does is that it increases stress in the endoplasmic reticulum and the mitochondria itself. In this process, these two, in an attempt to return back to homeostasis, these two increase stress, creating a feedback loop that only generates more and more stress, leading to more and more mutations. What is so significant about this particular drug is that it was not only approved in phase 2 trials, but this combination leads to decreased nerve cell death and also decrease the amount of damage that was shown in these particular patients. And it would also block cell stress signals, which is huge. And we were able to see an increase in the mortality of these patients while using Relyvrio. The last and most recent drug that was used is Qalsody, so approved in 2023. And one thing to know about ALS is that there's 2 main types that are talked about: sporadic, which is about 90% or 90 to 95% of all ALS cases, and then there's familial. And this particular drug targets SOD1 mutation, which is the second most mutated gene that is seen in patients with ALS. And so in the phase 3 trials, we were able to see that there was a significant decrease in the SOD1 protein levels, and there was a slower rate of disease progression overall. The reason that talking about this is so significant and why getting this knowledge out to physicians is so significant is that, as you can see from the timeline at the bottom, the last FDA-approved drug that was disease modifying came out in 1995. And since then, there has only been one that has been FDA approved, but it was for targeting symptoms. So the fact that within the last 6 years, we were able to have 3 choices for patients to use and hopefully decrease the symptoms that they were feeling or progress their lifespan is absolutely revolutionary and a huge impact in the ALS community. And I'm very excited to see how ALS researchers are continuing to put their time and energy into creating a more hopeful life for people with ALS. Thank you.
So these medications provide some hope for an otherwise very lethal disease. Where do you think things stand with regards to triggers of ALS?
So in terms of triggers with ALS, ALS is so tricky because its etiology is unknown or it's familial, and then there's a few cases in between. So even the risk factors for ALS or the triggers are not entirely known. There's some case studies and some researchers that say that using like antioxidants may make it better. Some say that being too athletic is an issue as well, and that may lead to you getting ALS. But in terms of sporadic ALS, it's hard to quite find triggers or have definitive triggers. But in terms of familial ALS, if you know that someone in your family has it, it is an autosomal dominant mutation for the most part. Then if you know that your dad or somebody has it, then you can go ahead and possibly get screened for it or get MRIs early on, so that if you do happen to see changes of or see degeneration in an MRI that you have done recently, then you can start targeting and using things like edaverone early on.